Salutations everyone, and thank you for watching another episode of DiabeticRadio.com. This is episode 37, and in today's video I want to talk about invasive surgery. I was having a conversation with my coworker last week, and he'd asked me whether if I would have considered something called bariatric surgery. And I told him that absolutely not. And it's really got me to thinking. I kind of spoke about this a little bit a number of episodes of the fact that we diabetics are a billion-dollar business. And it just doesn't go. The pharmacies aren't the only one that have a monopoly on this business. The hospitals and surgeons also have a monopoly on this business as well. And it seems as though that there are so many doctors that, well, it appears, sometimes it seems like so many doctors feel like the knife is the only solution to almost every problem. It's like you got a stomach ache, oh, let's operate. Your arm hurt, oh, let's operate. And something like bariatric surgery should only be an option to where it's an extreme circumstance. Extreme circumstance meaning you are like 600 pounds, you're bedridden, and you can't move, or your doctor tells you, if you don't lose weight immediately, you will die in the next 6 months or something like that. Bariatric surgery, I mean, that's some serious stuff, because what they do is that they, cut your stomach, they make it smaller, and they also literally rewire the plumbing in your stomach. And if you have allowed a doctor to perform the surgery on you, and he's not really, what is the word I'm looking for? He doesn't have that much experience doing that particular surgery, and that surgery becomes botched, then you have to live with that mistake that doctor has done to you. It's so important, and I don't mean to, beat this to the ground, but it also shows how important it is for you to do your research and read. And not only that, there's nothing wrong with getting first, second, third, fifth, and even sixth opinions, because as I said before, you can have you can have 300 doctors, and each one of those 300 doctors is going to have 300 very different opinions about the same disease, about the same surgery, about the same subject. So you want to make sure that you have enough information that you can possibly get, so that you can make the best decision for yourself. If you can try to take care of your diabetes by just exercise and diet alone, then oh my goodness, you are in business. If diet and exercise alone still is difficult, because depending on the situation, if you're type 2 and you produce very little insulin, you may have no other choice but to get on medication. That's unfortunate, and depending on the medication you're on, it can be very expensive for you. Or if you have to take insulin, but understand not only the type of diabetes that you have, but understand what's going on in your particular body for your particular situation, because no type 2 is alike. No type 1 is alike. No person who has LADA is alike. No woman who has gestational diabetes will be alike. So you have to understand what diabetes means for you in your particular body. Because, you may say to yourself, I want to get rid of this diabetes and elect to have these, dangerous surgeries, and it may not even be necessary. Doctors is going to flock to where the money is. This is not like 50 years ago where doctors actually really cared about you. Well, actually, let me change that. I'm sure that there's some doctors that will actually call their patients and see how they're doing and talk to them and stuff. But the average doctor, today, either they don't have time to give this kind of personal care to their patients because, A, they have to fill out so much paperwork. Oh my God, they are bogged down with so much paperwork that they have to sign. When I had to go through my surgeries on both my eyes, I had to go through so much paperwork because, somebody wasn't doing something right. And, anybody who has surgery before knows that when you have to get your blood test done to make sure that, everything is on level and everything is okay. You get your EKG. Once you get that seal of approval and that doctor signs that form, there's a month expiration on that form. So if you don't get that surgery within that 30-day time period, another form has to be filled out. And I remember, things was going so crazy for me. I had to give a new form at least 4 times, to my doctor. And every time I kept giving him a new form, it's like I could see his face. It's like, oh my God, but I really appreciated that he still filled out those forms for me so that I can, eventually get my surgery. These doctors should not have to be bogged down with stuff like that. You know what I'm saying? And then the other thing is that you got, like I said, some doctors are busy with other patients, which also cuts down on the amount of time that a doctor has available for each patient. And so, bottom line is, I know you want to trust your doctor, but a lot of the education still has to come from you. You have to seek within yourself to want to have the desire to know. And if you have a computer, know that you have a powerful tool, man. You have a powerful tool. Those of you who like those chat rooms, you need to get out of those chat rooms and start doing something constructive with your computer and really start learning about your health. Some of you guys know more about your cars than you do about your own diabetes. And I think we seriously need to focus on this. And the other thing is that another issue that I just thought about is, type 1s. We doctors thought that, one good way of curing type 1 is to have a pancreas transplant. I mean, first of all, that surgery in itself is dangerous because if your blood sugars are out of whack already, that in itself is a stress or a complication. You know what I'm saying? So if we understand that type 1 is an autoimmune disease, which means that the cells that are responsible for protecting your body and to make sure that there's anything foreign that's not supposed to be in your body that could be seen as potentially dangerous. It's responsible for killing that invading, source, be it bacteria, germ, or whatever the case is. And it's the same thing when you get a transplant. They're putting in a foreign body, into your system. This is why you have to take all these autoimmune medication to make sure that your autoimmune doesn't attack the new organ. which still doesn't guarantee that after all those medications that it still won't do it, you know. So having said that, why would a transplant, you know, pancreas transplant would cure type 1 diabetes, knowing that it's an autoimmune disease, knowing that at some point the same autoimmune is going to attack the beta cells in that new pancreas? Which means, guys, what I'm trying to say is that type 1 has gone through that surgery and stress in their body for nothing, knowing that the problem isn't the pancreas. The problem is the autoimmune problem that's in your body. So, long story short, to end the podcast, be careful. Don't jump on the bandwagon immediately the first time a doctor says surgery. Your insurance will normally, most insurance will allow you to change your doctors at least 2 times a year, and will allow you to see, more than one specialist at least 2 or 3 times a year. So take that to your best advantage, and talk to your insurance and call them and find out those specifics so that you don't get caught off guard later on. Know what your policy covers and what it doesn't. I hope this podcast has helped you and given you food for thought, and I look forward to creating my next video. See you again next time. Bye bye.